All right, everyone. Thank you for joining us today for our CareConnect convo with Dr. Kemba Black. I know a lot of us have kids at home and we have lots of questions about COVID-19 and children. Before we go ahead and get started today, we have a few housekeeping things we're going to go over. So if it's your first time joining us for a CareConnect convo, welcome. We're super happy you're here to join us with this conversation with Kelsey-Seybold. I'm Lane Galata. I'm going to be the moderator for today's talk. I'm a member of the marketing team at Kelsey and also a mom to 4 little ones. So I have lots of questions for Dr. Black that I'm sure y'all all want to hear the answers to as well. If you could just make sure your microphones are muted, that would be great. We want to ensure that everyone who is joining us can go ahead and hear Dr. Black, her questions and answers. And speaking of questions and answers, at the bottom of your screen in your Zoom box, there is a Q&A little box. If you have questions for Dr. Black during today's conversation, we highly encourage you to type them into that box. I'll be moderating that box and taking a look at it as we go through our conversation today. So we're going to go ahead and jump right on in with questions for Dr. Black. We're all here to learn about COVID-19 and how coronavirus is impacting our kids. One of the biggest impacts, especially with my children, has been education. They're not in school anymore. So Dr. Black, can you tell us a little bit about how can we continue to help our kids adapt to this new style of e-learning? And can we expect any challenges or how are they going to adapt when it's time to go back into the classroom?
Sure. So the first thing, hello to everyone. It's a pleasure to be with you all today discussing this, most important aspect of this pandemic, our children, and how we can best help them to get through this. So with respect to their distance learning, I mean, this is new for all of us. It's new for parents and it's new for the children. So the first thing is to, just be aware of that this is different for them. So they are adapting as well. So be patient with them. And, if they are getting frustrated or irritated or decide that they don't want to participate in things, just understand that may just be that this is uncomfortable for them and this is out of sorts for them. A lot of, by now, most classrooms are online to some degree or another. And many of the applications that your children have to use with distance learning and online learning, they probably have already used in the classroom. So you're not necessarily having to reinvent the wheel with all of these things. Kids probably already have logged on information and are familiar with how to use some of these applications. So if they know more than you do about some things, just go with it and let them lead you with respect to some of these learning platforms that they're using. To kind of help the situation, one of the things that you guys can do as parents is just a little prep work. If the teachers have sent out calendars or guides or guidelines, print the calendar out and highlight information that's going to need to be turned in for grading, or if the teacher indicates any things that are most significant for the students to learn, just identify those things and try to put most of your focus on that. You won't be able to get through everything, but you want to highlight those things that are most critical, particularly assignments that are going to be graded if that's appropriate for your child. It's challenging. It's challenging for everybody. Stay flexible. Don't beat yourself up if you miss the deadline. Communicate with the teachers if you're having any difficulties. And then in terms of challenges returning to school, I would advise parents to put that further down on your list of concerns. We all have a lot of things to be worried about during this time, but try not to focus so much on how your child is going to adapt going back to school. We don't know when that's going to be. There are some governors are talking about moving the start day further up instead of starting during the fall, maybe starting in late summer. So we don't even know when children are going to be back into a classroom setting. But just, allow the school personnel to stress more about that than you do. Try to keep your kids excited about learning during this time. Keep them focused on learning every day, even if it's not just with the curriculum-based material. Keep them excited about the learning process, and that should help them transition back into the classroom.
Awesome. So since they are at home and they're on the computers all the time, we know the AAP has, the American Academy of Pediatrics, has told us, we should really watch the amount of screen time with children. Do we know if there are going to be any impacts for the amount of screen time that children are now getting with distance learning and e-learning and the options that are out there?
So, as you've heard the word unprecedented used multiple times with respect to this, and it applies to screen time as well. Children are getting unprecedented amounts of screen time during this period where they are at home with their distance learning. As you mentioned, the American Academy of Pediatrics has set forth recommendations on the amount of screen time children should have. It is recommended that children under the age of 2 have no screen time or very, very little. Children from 2 to 5, no more than an hour a day, and children over 5 try to limit to 2 hours a day. Well, obviously, that's for most households going to be completely out of the window at this point. On a regular weekend, it's usually out the window. So what I would recommend is starting with the amount of screen time that your child is going to need for their learning process. They will have to be online for some of their academic work. So start with that. Don't count that in the hours that they need, that they're going to be on the screen. Just let them do that and get through it. And then from there, try to set some limits on the amount of time that they spend playing video games, watching movies and television shows. And you can try to implement the American Academy of Pediatrics recommendations beyond that.
So I know personally, my kids have a really tough time, especially my oldest, who is in 3rd grade, sort of decompressing after completing all his assignments. And it seems like he's focusing so much on the screen. Do you have any suggestions to help kids, especially, our high schoolers and junior high kids who are older and have a higher workload and more stressful assignments? Do you have any recommendations to help them decompress and relax right now?
Sure, absolutely. So to the best of your ability, if they can get out of the same space where they've been doing their learning, that would help. And, if you can get outside of the house, that would be great. Going for a walk, or for younger children, letting them play in a backyard if you are in a single family home, or if there's a relatively unpopulated park nearby, or just sit out in the driveway for 20 minutes and sidewalk chalk for younger children, or just reading a book outside in a chair. Just breathing different air can be a great mechanism for children and parents also to decompress. Other things like exercise, go outside and do jumping jacks, or, mountain climbers, or, whatever, any of these kinds of things. If children play an instrument, it would be a wonderful thing for them to do to kind of decompress and just put them in a different kind of headspace about the situation. Those are all things that you guys can try. And then also, it would still include screen time, but calling a family member. We haven't talked to grandma in a week. Let's Zoom in or FaceTime with grandma. Just talking to someone who's not in the exact same setting and situation that you're in can help children and families to decompress.
So we're all just completely encompassed with COVID-19 right now, everything from education to taking care of ourselves as parents. But what should we be talking to our kids about regarding COVID-19? They see it on the news. They've been impacted by it because of school, so they're aware of it. But as regulations keep changing and new suggestions come out from the CDC, how can we best approach these with our kids so that they're not more overwhelmed than what they are now?
Sure. So you mentioned that, Rob, that they're seeing it on the news. Try to avoid that. Even as adults, we need to limit the amount of input that we get about this situation, because it can be completely overwhelming. If you just kind of give yourself an update in the morning or in the evening or both, but try not to watch information about it throughout the day, because it's probably not going to change your day-to-day activities from one day to the next. You'll get the information in a timely fashion, even without watching the news all day. I would really recommend, especially for younger children, just restricting their input of news coverage about coronavirus, because the younger the children are, they're just not really going to be able to put all of that in context. There is so much information being presented about health risks and school closures and government reopenings and the economy, and it's just way too much for a child to tolerate or to process. So, you're going to have to act as a filter for your child for that information. You want to try to tailor your discussions with your children to their age. The conversation you have with a 5-year-old will be different from that which you have with a 16-year-old or a 17-year-old. So just talking to your children about the fact that there's a virus or a germ out there that is making people sick, and nobody has ever seen this one in humans before. So we really have to just be very careful and take certain steps to keep people safe. And then discussing what those measures are. We're hand washing just like usual before we're eating. We're trying not to touch our faces if we don't have to. Talk to kids about picking noses and wiping their eyes and all of that, which are conversations that, many of you are probably having on a regular basis anyway. But just try to keep the information focused, targeted, and age appropriate for your child.
So since we're on the topic of more emotional support with kids, I know I myself have a lot of anxiety about bringing my kids out in public because the CDC has recommended that kids age 2 and up wear a mask. So my kids are 8, 7, 5, and 4. So every one of them should have a mask on if they go out in public. Do you have any suggestions about easing those fears and how to talk to kids about the importance of wearing a mask and why we're wearing a mask?
Sure. Again, keeping the conversation focused and practical for children. So just talking to them first about why we need to wear a mask. Well, what does the mask do? It keeps you from breathing out germs onto other people, and it keeps other people from breathing germs onto you. So that's why it's important to keep the mask on, to protect other people and to keep ourselves protected. If children are having difficulty, if they are fearful about seeing people in masks, try the mask on at home, have them look in the mirror. They can, put it on a stuffed animal or draw a picture, of their favorite character with a mask on. Depending on the age of a child, you might present it in the way that superheroes wear masks too. And so this is one way that we can keep ourselves strong and healthy, but that it is necessary under those circumstances which children will be leaving the house.
So when we're talking about masks, I know at Kelsey, we are requiring patients to wear masks now as well when they're coming in for visits. So can you tell us a little bit about virtual visits with pediatrics and what type of visits we are seeing in the office at this point?
So at this point, our in-office visits are limited primarily to physical appointments. So children who need an annual well visit, and specifically those who need vaccines at this time. So that's going to be our infant visits through 12 months of age, 15 months of age, 18 months, 2 years, and then those who are 11 years, 4, 11, and 16. Those are typical visits when we do vaccines. We have not quite opened our schedule up to all patients who need physicals, and just in an effort to keep everyone protected until a later date when it is safer to have more patient population in the clinic. We want to keep our waiting rooms relatively clear of groupings of patients. So we're just at this time limiting visits to well visits where children need vaccines. We will have the occasional patient who maybe has an injury that needs to come in and be evaluated, but nobody with respiratory or gastrointestinal illnesses at this time we are having in clinic. So alternatively, we are doing video visits that work similar to what we're doing right now, where you are able to connect with a physician through video visit. We discuss symptoms, come up with a plan and a treatment plan and evaluation to best care for your child. So we are offering those at this time for any children.
We have some more questions that came in about anxiety with kids and really truthfully how do we support our kids at home? As a parent, what are some signs of anxiety that we should be looking out for with our kids at this time?
So changes in their behavior, if they are reluctant to do the things that they used to do, they are reluctant to, come out and talk to you and open up about things. If you try to get them to go outside for a bike ride and they seem unusually afraid to do so, or they express to you verbally that they are scared to go outside because they don't want to breathe in coronavirus if they, open the front door and leave the house. Those can all be signs of anxiety in children, in addition to change in sleep patterns, if they're staying up later, having difficulty falling asleep. All of those are things that you may see. Crying more, temper tantrums, those kinds of findings.
So I'm glad that you mentioned sleep, because in our house, we're having a lot of trouble staying on schedule. We're in a new routine working from home. Kids are home. Is their schedule really important to keep in terms of the same schedule they would keep in school? Or is it more important for us to find our new normal right now as a family?
Sure. So a schedule is essential. It doesn't have to be the schedule that you used to do, because this is not the way things used to be. But a schedule is going to be critical for keeping everyone in a same place, keeping the order of things in a household. Even if it's someone who lives alone and doesn't have children, you want to kind of put yourself or have some idea how your day is going to be ordered. The key with a schedule with children is that you have to be flexible. So you want to have an outline of how the day should go and discuss that with your children so that they know what to expect. And that can limit some of the tantrums and the disagreeability and opposition that children can express or display if they know what to expect next. So if you put together a schedule where you have math and science on Mondays and Wednesdays, or you do math and science in the morning and reading and writing in the afternoon, just be willing to switch that up or change it up if necessary. If, your child doesn't want to do math today, they want to do it tomorrow. Well, that's okay. It's not the end of the world. Let's switch to reading and do something different. Or if you are starting your day with academic work and your child just seems intolerant to it, then just take a break, take a brain break, go outside for a walk, or, do some exercises, or just switch it up for a little bit, just so that everyone can try to, tolerate the process and get through this.
So kids who were struggling before are kids who have ADD or ADHD or behavioral issues that parents were communicating with our pediatricians to help them find a solution for their kids during normal circumstances. How can we support those parents during this time? Are you doing video visits to continue to support parents, or do we have a different alternative to help parents with that right now?
So we are definitely still doing video visits. Parents can contact us through a variety of means. We have My Kelsey online. We still have nurses on the phones if parents need to call and get advice or information from the doctor. And we certainly are doing video visits for follow-up of ADHD or any other concerns, behavioral issues that children are displaying. The first thing I would say is, if your child is on a stimulant medication for ADHD, you want to the best of your judgment and what works in your household, you want to try to keep that child on their medication schedule. If they typically take it Monday through Friday, go ahead and plan to do that, because they still have responsibilities and obligations with their academic work for which they would need to focus and be able to stay on task. If they take it 7 days a week, give it 7 days a week, and if you have questions about whether or not they should still take it, you can contact your individual pediatrician and they can help guide you through that, how to best walk your child through this process. But again, as we discussed, the supportive measures, the flexibility, having a schedule and an anticipated routine for the day can also help to keep your children on task.
So I don't know if everyone who is attending saw the news yesterday, but there was a great story in our local media about supporting high school seniors right now during their milestones. We have lots of graduating seniors from college and high school who are really missing an important event in their life due to coronavirus. What can we do to support students who are in that position during their time as parents?
So the first thing I would say is be empathetic with them, and understand that this is a huge thing for them to be thrown off of their natural course, with graduations and proms and the senior activities that kids usually have at the end of the year. Talk to them about how they're feeling, and try to get an honest assessment of where your individual child is. Just because you didn't care about prom when you were, 18 or 17 doesn't mean your child doesn't. Some of these kids have been waiting for these events for years, for 4, 5, 6 years, working hard, towards graduation. Some of them have had stumbling blocks, weren't sure that they were going to graduate. So just understand where your individual child is on that spectrum. Secondly, most parents are probably receiving communications from the district about rescheduling of these events. I know Sci-Fair has put together an alternate schedule for graduations and proms for the high schools. So just make sure to follow up with the district, or you can certainly contact your school's principal or teachers and see if
So now we're going to talk a little bit about physical health with kids. Can you tell us a little bit about helping kids getting exercise right now during COVID-19? How much exercise is too much exercise for a kid? And I know you mentioned going outside doing some jumping jacks and mountain climbers and things like that, but are there limitations we should put on that to sort of protect our kids so no one gets hurt or anything like that?
Sure. So what I would say is too much exercise is an amount or an intensity that leads to injury. If your child is complaining, of stiffness or soreness in a joint or, a muscle group, then, and that they have really been doing, a large series of a certain type of exercise, then it is probably time to either switch it up or take a break from that type of exercise, particularly things like weightlifting and resistance training. That really needs to be alternated with aerobic exercise, walking, riding a bike, jogging, those kinds of things. And then also any amount of exercise that is just consuming the day. Children don't need to wake up in the morning exercising every hour until the end of the day. So, bursts of exercise, a couple of times a day is fine, but they still need to be able to have time to just relax, kind of lay around, read a book, do some other types of play or activities, and also get their academic work completed for those who are still in school.
So I don't know about your kids, but mine are begging to see friends and grandparents and, classmates and go on play dates. Now that our guidelines are starting to relax a little bit, how soon is too soon for us to say, okay, you can have a play date with friends versus seeing grandparents, knowing that grandparents may be in a more vulnerable population with, higher risks from COVID-19?
Sure. So my short answer is not yet. It's just not time for play dates yet. And you really have to think about the impact that it's going to have on your particular household and your family. I think at this point it is probably safe to err on the side of caution and just assume that, that interaction may lead to someone contracting coronavirus. It's possible, it may not. But you have to consider what's going to happen with your situation if someone does get infected as a result of that play date or that interaction. And so if you have a grandparent living in the household with you, or you have to, as a parent, have to go check on a parent of your parent to, make sure that they have what they need, then it is really best to just avoid close contact, in the form of play dates at this point. Children, by and large, seem to not manifest many symptoms of coronavirus, and their symptoms tend to be milder. So the concern may not be so much that your child is going to get overwhelmingly ill, but the virus can certainly transmit from one person to another, even when there are no visible symptoms. And so you really want to continue to exercise vigilance and caution within your family and household at this time. So I think we're just not quite there yet on the play dates and more interactions between households.
So in the future, if as guidelines are relaxed and it becomes safer for us to start visiting family and friends, if you have a child with an existing condition such as asthma, should you be more vigilant in protecting them and keeping them home longer, knowing that they have a respiratory issue?
Yes, so to the best of your ability, certainly everyone's situation is going to be a little bit different. Some parents have to get back to work or are first responders, and certainly they can have children with asthma and health conditions just as much as anybody else can. So I would say if you have the ability to keep your children out and away from large groups, do that as long as you can. For children who have health conditions, you want to, again, individualize your approach. Just because, malls open up or movie theaters open up or restaurants open up, it still may not quite be the right time for your child. Again, you have to consider the impact or the consequence that would occur within your household if someone were to get ill with coronavirus. So, just individualize these recommendations to keep your family best protected.
So we have some questions coming in about protecting your family with masks and the
Sure.
different type of masks. What are sort of the protection levels that homemade masks and handkerchiefs and cloth coverings offer for kids?
Sure. So the cloth masks and the homemade masks are not going to offer 100% blockade or decrease or completely avoid transmission of coronavirus. The cloth, the material is porous. The best thing to prevent transmission of coronavirus with respect to a mask is an N95 mask. And so, those are not really available to the public. Those are only, for use in hospitals at this time. But the design of that mask is so that it minimizes transition of 95% of what are called nanoparticles. So these teeny tiny little things like viruses. However, use of cloth masks and, handkerchiefs and that kind of thing can diminish transmission of like respiratory droplets, saliva, and keep respiratory droplets from moving beyond your personal space. So it is definitely recommended that is in use, especially if you're going to be somewhere where there are a lot of other people. If you have to go to the grocery store or the pharmacy, or you have to be out in a public space, you want to do that because it is some protection. And especially if those around you also have on a mask, then you are decreasing from both ways transmission of respiratory particles and droplets.
So we have another question that came in. Now that the governor has given permission for places of worship to open as well and to host services, what would you recommend for children's church services? Would you recommend following the same guidelines as when it's safe for your child to go back to school for them to attend children's services, or does it follow into the same guideline as general places of worship?
So, my recommendation on this is, as I mentioned before, you have to kind of individualize this for your own household, and consider what exposure would mean for your household. My thought about this is, my recommendation about this is, it takes up to about 2 weeks for anyone who has been exposed to coronavirus to begin to manifest symptoms, if they are going to manifest symptoms. So as things open up in this staggered approach and people are gradually beginning to get out into more public and populated places, we will have to wait some time to see what impact that is having on the spread of the virus. So it won't be the case that, church opens up on Sunday by Monday, if it was okay. It could be up to 2 weeks later, impact of the spread of the virus are to public places and in closer timing. So it's going to take a little time to see what the result of that is going to be. So, everyone has, each household will have to individualize that. If your faith or your need to be in your place of worship is an intense thing for you, and you are willing to assume the risk, or you're balancing, the risk of getting infected with that, then, you have to just kind of individualize that.
So we have one more question that came in. I know we're getting close to 2 o'clock and you need to get back to seeing your patients as well. So our final question for the day is about masks again. And I think this is an important question for parents to know is, if your child wears a mask out, how can you safely wash it? What is the protocol? Do you Lysol it? Do you wash it in the washing machine, hang it to dry to eliminate any further contamination?
Sure. So these cloth masks are supposed to be washable, machine washable, warm water. Any kind of, typical laundry detergent should be sufficient to remove any residual particles, viral particles from the mask. So washing, drying in a typical fashion that you would wash and dry your clothes should be perfectly appropriate.
Great. We're going to go ahead and wrap up today's conversation. Thank you, everyone who joined us for CareConnect Convos today. We are going to be continuing to host CareConnect Convos as long as we possibly can. So this week, our focus is pediatrics. So we had our talk today with Dr. Kemba. Tomorrow, we're actually having a chat for expectant moms with Dr. Megan Pallister. And tomorrow night, we're hosting our first virtual Baby on the Way event. So if you're an expectant parent who tuned in today or have friends who are expecting during this uncertain time, please tune in. We have lots of great information we're going to be discussing with our physicians during this time. And Friday, we're going to be having a conversation with Dr. Melanie Mazoon, who is our pediatric hospitalist here at Kelsey-Seybold. She's going to be discussing the impact that COVID-19 has on kids in terms of treating them if they are positive for the virus, and what we're seeing with signs and symptoms and trends of coronavirus for kids. So thank you all for tuning in today, and we hope that you'll tune back in later this week for more conversations with us. If you have any questions, you can submit them on our Facebook page. We do have a live stream there as well. And our website, Kelsey-Seybold.com, has lots of great information about coronavirus and the most up-to-date guidelines and recommendations from the CDC as well. So thanks again, everyone, for tuning in. Thank you, Dr. Black, for joining us. And we hope everyone has a great afternoon.
Thank you.